Hey guys, I was just reading over the comments here on Hair Loss Hope, and I saw this really well-written comment by a guy named Michael Ash, and he had 5 questions that he wanted to ask a hair transplant surgeon. And so since I'm here hanging out with Dr. McGrath, I thought I would get him to answer these questions. These are really excellent questions. So Michael, we're going to answer your questions right now, and I'm also going to make Dr. McGrath age by about 17 years right now. All right, so here we are 17 years later with...
I'm not very happy about that, by the way. I don't think any of us like to get older, but hopefully I'm doing it with a little bit of grace.
So here we go, Dr. McGrath. First question from Michael. Have there been any advances with FUT surgery in the last 10 years, including the harvesting, placement, and/or healing techniques in the last 10 years?
Absolutely. You know, FUT in many of our hands is still considered to be a gold standard. There are different techniques that we use for closure. There's different approaches that we use in terms of how large a strip that we may or may not take. Of course, there's been the advancement of the use of the trichophytic closure, which helps the hair to actually grow into the scar. There's also been the advance of actually using the A-cell powder, the A-cell micromatrix in the closure, which helps it in many occasions to be very much a seamless scar. But I think probably the largest thing is that because we know that we also can use FUE, there's a lot of times when surgeons can actually use an FUT procedure. They can take maybe a little bit more of a limited strip where it's not quite so wide, thereby allowing for not such a tight closure, and then we can harvest around that using FUE, so we get the best of both worlds. So we have a nicer closure, because remember, the closure technique, even in the best of hands, you know, you can do a perfect closure technique, and sometimes patients might have a little bit of stretch out of the scar, or it might be a little bit more visible. That's not always necessarily an issue that comes down to technique. A lot of it's just Mother Nature and it's physics. So if we can manage to have a thinner donor scar and then maybe harvest some of that hair from surrounding areas that is good, we can kill 2 birds with 1 stone. The question that might come up is, well, why wouldn't you just do it all with FUE? Sometimes there are patients that with FUE or with strip excision, in a particular region of the donor, the hair is the best. And then outside that region, it's very soft, it's wispy, it's fine. It's not going to necessarily hold up very well. So when we can, we like to get that very best hair. And if we were to do it all with FUE, you'd end up with a particular zone of the scalp that would be completely decimated, and that doesn't make sense. So we've used a hybrid procedure on some occasions where we can get a lot of the best hair, maybe not such a wide excision, but then combine it with some FUE to where we can still get a good number of grafts and accomplish the case. And I think that's been a great combination with using FUE and FUT.
So the second question right here is, and there are 5 of them, what are the percentage breakdowns of the following results after surgery? Outstanding results to good typical results to poor results. Off the top of my head, this is Michael, off the top of my head, I'm guessing it's something like 10%, 80%, 10%. I've never seen a doctor who's been asked this question. I wonder if they would ever answer it honestly. Well, it's funny because I was actually going over these answers with Steve Cook earlier, and he was saying, well, this is kind of a little bit of a loaded question because it depends on who you operate on, right?
Certainly.
So if you only operate on only the best candidates for hair transplants, then you basically should always get great results, right? Outstanding results.
Yeah, the results are going to tend to be better, and it is. I mean, I wouldn't say it's a loaded question. It's an understandable question because I think what you're really asking is, if you take any given surgeon and you ask them honestly, what % of your cases would you say are outstanding cases? Well, of course, that's a difficult question, I think, for anyone to answer. But let's just say surgeons like myself that have been doing this work, let's say upwards of 18 to 20 years. What we have learned is that just because somebody comes in and they want a hair transplant, it doesn't necessarily mean that they're a good candidate for hair transplant. It's not necessarily that we're trying to cherry pick, but sometimes you realize that, you know what, this may not be the best approach at this given time. So I find myself more and more these days maybe trying to optimize a patient with medicinal approaches first, then bringing them back and trying to assess what is the quality of the donor hair. I will tell you this, what I think the best way to answer that question is the success or failure of a hair transplant case is going to be largely predicated on two main factors. One of them is going to be what is the quality of the donor hair. If you've got really strong, great donor hair, you're going to end up with a pretty nice result. The second of those two factors is going to be what is the skill of the surgeon? How long have they been doing this work? And how dedicated are they to producing really good, high quality work? If you ask me, and I'm being as honest as I possibly can be, I would say 75% of the cases I do are outstanding. I would say maybe 15% of the cases are certainly better than average, and then maybe you've got that 5 and 5% where you come back and you see the patient and say, you know what, I'm not happy with that. I think we could have done a better job. And that's just off the hip. But certainly in my practice, I think I can say with a great deal of honesty that there are very few patients that I'm putting in the chair unless I really am confident that they're going to get a good result. Because let's face it, they're going to be paying a lot of money, and it does me or them no service to put a patient in the chair just for the sake of doing a hair transplant when you know there's a question that it may not come out so good. The hair is fine and thin. And there's plenty of those cases that go around. We see a lot of these clinics all over the world, really. We've had conversations about this. We make a joke in the industry. There's some surgeons that, they never met a head they didn't like. I'm at a point in my career where I maybe have the good fortune of not having to do a case on everyone that walks through the door. But to me, it's more important that if I'm going to promise a patient that there's going to be a certain level of result, I think I should be able to provide that. And in my case, I think I'm being honest, I'd say at least 75% of my patients come back and they're overwhelmingly happy with the work that they've had done. I think that's a fair number.
Cool. Well, number 3 is not counting a poor donor area. Are there any other factors that will make the doctor advise the client not to do surgery? So I can say one, if you have any others, feel free to share, but I think having too high expectations
Absolutely.
is one, right?
Absolutely.
So I mean, even if the donor area is perfect, but they're already pretty bald or whatever the case may be, if they're like, hey, I want to be like, I want to have Johnny Depp's hair when he was 19 years old, and if you can't do that, I don't want to do surgery, you're going to say, well, then I don't want to do surgery.
Anyone who watches this video who has seen me, who has been in consultation with me, will know, and I say this to everybody, there are two things that I've learned that I cannot control. One is Mother Nature. If you're going to lose more hair, if we're not able to get you on a preventative measure, you're going to lose more hair, you're going to lose more hair. I can't control that. I tell people, I can bend Mother Nature, I can't break her. That's number one. Number two is I can't control what a patient's real expectations are. What I think I've gotten a lot better at over the years is being able to assess what a patient's real expectations are. And if I have a patient, for example, that comes in and flat out says to me, listen, I only want to do this one time, and if I see any scalp at all, I'm telling you right now, I'm not going to be happy. Then I just simply say, well, I appreciate that, and I understand that's reasonable that you would feel that way. I'm not your guy. That no one can produce that, and if that's how you really feel, I honestly think that you should save your money and you should not do the procedure, because you cannot guarantee that. I tell every patient, in the back of your mind, plan for a second surgery, because what if you do lose a little bit more hair? Or what if the result is phenomenal, but you wish it was just a little bit thicker? So I just think that's a conversation that should be had right up front, as opposed to a year after the procedure and the patient comes in and says, oh gosh, I thought it was going to be thicker. So I just think all of that is best dealt with right up front. But obviously, someone that's got unreasonable expectations, That's a no-brainer. That's just not somebody that anyone really wants to be working with, and not just for your own peace of mind and sanity, but for the patients as well. It's not fair to put them in that position.
Yeah. Number 4, in the event of poor results on top, or in the event many years passed after surgery and the client wants to go with a more clean-cut look, which scars are easiest to camouflage with SMP or other means, FUE or FUT scars? I mean,
if a patient wants to do a linear procedure, wants to do a strip excision procedure, and then down the line they decide, you know what, I think I'm just going to buzz my head. Versus the patient that has had an FUE procedure and down the line they say, hey, I just want to buzz my head. A lot of it is going to depend on the color of the patient's hair versus the color of their scalp. If you've got black hair and white skin, obviously you're going to see changes no matter what. I could show you plenty of examples of guys that have had FUE and they zip their head down, and you can see thousands of little white spots on the back of your head.
I've got friends like that, yeah.
In fact, the studies that have been done show that in a linear procedure, percentage-wise, there is less scarring than there is with an FUE procedure. However, if it's an experienced surgeon, and if they're using a very small punch, maybe a 0.7 or 0.8 millimeter punch, you can get away with having pretty minimal scarring that maybe is even undetectable if they zip their head down. So I will say that. In my hands, and I know with other very well-skilled surgeons' hands as well, if they have a linear scar that they're not happy with, what I've been able to do very effectively, and I know other surgeons too, is they can bring the patient back. They want to zip their head down, they have a scar that's visible. We can take and do a small FUE and we can transplant into the scar. That'll certainly camouflage at least 50 to 75% of the scar. And then you can easily come on top of that with some SMP, and many times get it to where it's pretty acceptable. There's going to be, of course, occasions where no matter what you do, there's still some evidence, but I've had plenty of occasions too where we've done that and there's no visibility whatsoever. So I don't want it to sound like I'm not really answering the question, but some of it just depends a little bit on how bad the scar is, obviously. If it's not a very bad linear scar, it should be very easy to cover with SMP. If you've got a linear scar that's, you know, a quarter or half of an inch wide, that's going to be a little bit more challenging.
Also, I mean, it does also have to do with the color of the person's skin.
Absolutely.
And their hair as well.
Absolutely.
So it's like a darker guy who, let's say, like a Mexican kind of, you know, dark brown skin.
Yeah,
type
anyone
look.
who's got a Fitzpatrick skin type, let's say 4, 5, or 6. So they, you know, that might be maybe someone from India or someone from Mexico. Their skin's a little bit darker, or an African American patient where the skin's darker. Of course, there's less contrast.
It's going to be easier.
And so
to
it might be
that.
much easier to blend that versus, you know, the guy that's got red hair, blue eyes, and white skin. That might be a little bit harder with SMP. But I think that, you know, common sense would dictate that.
Last question is, during a FUE procedure, does the doctor immediately know if transection of the follicles has occurred, or do they only learn the percentage of loss after a year? I ask this because in videos on a very popular YouTube FUE clinics channel, the doctor always tells the patient during the procedure exactly how many grafts they collected, including number of hairs per graft. Very cool, but it makes me wonder, are all those good grafts, or are 20% of them possibly transected? So there's a couple different questions in there.
No, I think I know what they're asking.
Cool.
It's pretty straightforward. When you're doing an FUE procedure, obviously the first part is you're using some type of a device. And it's usually either going to have a sharp tip or a blunt tip, it depends. I know what my particular device is that I like. You're going to start by making the passes, and usually you'll do them at 100 at a time. Some people will go beyond that, maybe do 200 or 300 passes, and then they start to gently harvest the hair out of that. As they're harvesting the hair out of that 100 or 200, you know, unit, we'll sometimes break it up into sections. We'll harvest, we'll do say 200. And as we know, we've made 200 passes, and we'll pull all of those out, and we'll know immediately if it's a viable graft or not. The staff will then take all of those grafts, they'll separate them into various size grafts, 2-haired grafts, 3-haired grafts, single-haired grafts, etc. And they should be able to immediately tell you Of those 200, we've got 185 that are good. Okay, well that's about a 7% transection rate. So what I do personally is I start off with batches of 100, because as I'm going through this, I'm trying to get a certain rate and a certain pace, okay? And then I'm having my assistant come behind me, and they're slowly helping to pull and extract the graft, okay? After that 100, we take a look and we see, how am I doing? What's my transection rate? And for me, if it's 5% or less, I know I'm doing a pretty decent job. Part of the FUE procedure is you want to develop a certain amount of speed, but you don't want to go so fast that you're just chopping grafts up. And that's why I like doing it in bundles of 100. And after the first couple hundred, if I'm staying consistent with my transection rate, there's going to be some no matter what. I mean, even in the best hands, there is some transection. Understand something though, as those grafts are being brought out of the scalp, they're being placed in a wet container, they're being counted and they're being separated. If you've got a transected graft, it's not going to be used. It's going to be set aside, okay? So yes, when we talk about a transection rate, what that really relates to is, out of all the passes that you made, what percent of those were successful? So yes, in one way it may sound like, wow, this guy ended up having a 10% transection rate. That doesn't mean though that 10% of the hair that's been put into your scalp is transected hair.
It's 0% basically, right?
Because you're only going to use the best grafts. If there's transected hairs, that's going to be set aside, it's going to be discarded, it's not going to be used.
Now, something that does happen on, I know, like a lot of lower quality clinics, they will put grafts,
that's
right?
correct.
That it's a common, I don't want to call it like scam or whatever you want to say.
I'll tell you exactly what they do.
Yeah.
The technicians get in and they go to town. They do as fast as they can. Someone comes behind them. They don't even bother counting what's good, what's not, until they get to a certain number. And they don't even look, many times they don't even look to see if it's a decent graft or not. Is it a viable graft? Is it too skinny? Is it skeletonized? They don't look at any of that. They just are looking at, grabbing numbers. And then they'll transplant, with follicle or not, they'll transplant.
Yeah, I get sent a good amount of pictures on like Instagram. Guys will send me, hey, I just got out of surgery. Like, I don't know why people always contact me like the day after they had surgery. I'm like, I could have helped you like 3 days ago potentially, but they're like, hey, I just got out of surgery, or sometimes it's even months later, and they're like, here's my pictures after I had surgery, and their head is like full of grafts. It's like packed full of grafts. And then they write me months later and they're like, hey, why?
Looks like half of them didn't grow.
Yeah, like so many of them didn't grow.
Yeah.
And, it looks great afterwards, and then they fly home and they're like, great, I got a whole head full of hair.
I can tell you pretty much without question, any good reputable surgeon, whether they're doing strip excision or follicular unit extraction, when they're doing these extractions, they're separating those hairs. We know exactly how many 2 hairs, how many 3 hairs, how many single hairs, and they're placed into separate groups. And we know exactly how many hairs have been extracted, which allows us to calculate what our transection rate is. The transection rate really is an indirect measurement that's telling the surgeon, hey, you might be going a little too fast because the quality of the graft you're getting isn't very good. So in that first 1 or 200, if the transection rate is a little too high, you might need to make some adjustments to your technique. Maybe you're coming in a little too sharp of an angle. Maybe you need to adjust the depth or the speed of the device you're using. So it's used as a gauge. But any reputable place, any place that's really trying to get you the very best results, they're only going to use the hair that they know is going to grow.
Yeah.
Whereas other places where they're charging you by the graft, they don't care. And it's the technicians that are doing it. They could give a rat's you-know-what as to whether or not it's a good hair or not. But for me, at the end of the day, I'm the one that's going to have to deal with a patient if they come back and they have poor results. So it doesn't serve me to transplant a hair that's I know isn't going to grow. That doesn't make sense.
I think the easiest way to combat that is just to make sure that you go to a surgeon, to a company that is well known, that is reputable, that has a history of great results, that has a history of being in a certain location so you know that you can go back in, walk through the doors, and talk to them afterwards and go, hey, like, let's discuss this. But the issue comes in places, and more often where, you know, it's a place you probably would never visit again. And so you fly there, you get the thing done, you fly back, you don't even know if 2 months later they're going to be in business. And I've had friends that have gone through, had this exact experience.
And I really think it's very important if you're, you know, ready to choose a clinic or a place. I think the surgeon or the group that you're working with should be more than happy, if you should ask, more than happy to provide you with 4, 5, 6 references of other patients that they've worked on with a similar type procedure. That is very easy. That should be done automatically with no problem whatsoever. And we have a list of patients that are happy to talk to our patients that are thinking about having work done.
Thanks so much, guys. I appreciate the great questions.
So do I. Appreciate an opportunity to speak to you. And really, you know, the bottom line with all this is we're really just trying to educate all of you guys out there so that you don't end up being one of those guys that goes in and then finishes the procedure and says, oh my God, I made the biggest mistake of my life.
Yeah.
It doesn't have to be that way. There's great surgeons that do great work. And I'm telling you, if you just ask the right questions, you can find them and you'll be very, very pleased.